Hi everyone, my name is Vermaas, and for this assignment I chose 2 episodes from the Population Healthy podcast produced by the University of Michigan School of Public Health. So I selected these episodes because I'm genuinely interested in public health, especially after living through the COVID-19 pandemic. We all lived through it, and experiencing a global health crisis firsthand made me curious about how both infectious and chronic diseases affect communities and what public health does to prevent and control them. So the first episode, entitled Reemerging Infectious Diseases, in that episode it explores communicable diseases that are caused by infectious agents that spread from person to person, which is essentially the definition of a communicable disease. One expert did explain there's no denying that the COVID-19 pandemic changed the way that we collectively view infectious disease. And the episode goes on to describe how diseases that we once thought were under control or never existed in humans before could reemerge or newly appear, and how public health works to monitor and respond to these issues. For example, an epidemiologist said evolving pathogens are producing new diseases that are different than those that have ever been known before. And this public health perspective shows the importance of surveillance, early detection, and preparedness in controlling outbreaks, which is basically all key concepts in communicable disease control that we study in Chapter 4 in our textbook. The second episode I listened to is entitled Putting Oncologists Out of Business. This episode actually focuses on cancer, which is a major non-communicable disease. The host interviews an epidemiologist who actually said, we know that it's actually possible to eradicate cervical cancer now between vaccination and HPV and screening for early detection. That statement ultimately highlighted prevention strategies, and she goes on to explain her passion for preventing cancer by stating, I want to put oncologists out of business. That's a huge statement, meaning that preventing disease is better than treating it. The emphasis on prevention is central to non-communicable disease control, like heart disease, stroke, and cancer, which are among the leading causes of death globally. Primary prevention through vaccination and screening and healthy behaviors and early detection could reduce disease among disease burden long before treatment's needed. And essentially both episodes together demonstrate the multi-causation disease model that we learned also in Chapter 4, which demonstrated that diseases are basically influenced by a combination of biological factors, environmental exposures and behaviors, and the social determinants of health. Communicable diseases involve pathogen transmission and host response, while non-communicable disease involve lifestyle and long-term exposures that accumulate over time. So to wrap this up, these population healthy podcasts help me to see how public health professionals think about disease prevention and control in real life, whether it's preparing for reemerging infectious diseases or basically reducing chronic disease risk. And listening to these episodes reinforce what Chapter 4 teaches, which is prevention and early intervention are essential to protecting community health. Thank you.